Today we have Dr. Benugopal Mahopatra, dermatologist from Kolkata.
Hi, myself Dr. Benugopal Mahopatra. I am a dermatologist working in Kolkata.
Doctor, is urticaria and allergy similar? How serious is urticaria in India?
Look, urticaria, commonly known as hives, are transient red, itchy, raised areas over the skin that can range in size and appear anywhere on your body and vanishes within a day. Urticaria can be one of the first symptoms of a severe allergic reaction known as anaphylaxis, and which should always be treated as a medical emergency. But majority of urticaria are not due to allergy. Hence, both are similar but not the same thing. And about how serious is urticaria in India? Acute urticaria where the symptoms fade within 6 weeks and can usually be treated with antihistamines. But chronic urticaria is a relatively common condition in India, and most cases have no specific allergic trigger and remain idiopathic.
Doctor, what are the causes of urticaria and what are the aggravating factors?
Well, urticaria occurs when histamine and other chemicals are released under the skin surface, causing the tissue to swell and initiate the pruritus. It is often not known why chronic urticaria happens or why short-term hives sometimes turns into a long-term problem. The aggravating factors are unknown, and around half of all cases that are idiopathic. Some recognized triggers include like a food allergy to food like peanuts, shellfish, eggs and cheese, an allergic reaction to environmental factors like pollen, dust mites or chemicals. Other triggers are like insect bites, stings, emotional stress. Certain medication also can cause urticaria as a side effect like NSAIDs, aspirin and some antibiotics also.
Doctor, is there any particular season during which urticaria happens more?
Well, I don't feel so, as the trigger of urticaria can happen in any season. Though some data suggests that cholinergic urticaria may occur in winter, although the disease may persist during the rest of the year also. Again, it all depends on the trigger of urticaria for the patient. But as I said, no need to panic, as the dermatologists today are all equipped to provide relief during urticaria with normal life for the patient. So in case you have any symptoms, visit your dermatologist immediately.
Doctor, how to prevent urticaria? Is there any specific diet to follow?
Yes, there are some ways to prevent urticaria, like avoiding the specific triggers. These can include foods, medications, pollen, pet tender, latex and insect stings. If you think a medication is causing your rash, stop using it and contact your primary care provider immediately. Some studies suggest that stress or fatigue can trigger also urticaria. Other ways to prevent urticaria, like apply cold by covering with a cold washcloth or rubbing with an ice cube over it for a few minutes, which also can help to soothe the skin and prevent scratching. Also, wear loose, smooth texture and cotton clothing, and avoid wearing clothing that is rough, tight, scratchy or made from wool.
Doctor, my child is 8 years old and having urticaria. What should I do?
The best treatment for your child is to stay away from known triggers. If the hives were caused by a medicine, your child should strictly stay away from that medicine. Also, visit your dermatologist. They will give some antihistamines which are approved to be given in children and are also non-sedative, such that your child's sleep is not disturbed. And for better compliance, these are also available in some flavored syrup which will have no problem in administering to your child.
A public awareness initiative from Dermachem, a division of Alchem Laboratories Limited.